In the basic cancer genetics and tumor biology course, we explored the key differences between germline and somatic mutations. Germline mutations are inherited. They're found in reproductive cells and can be passed on to children. Somatic mutations, on the other hand, occur in non reproductive cells and are not inherited. These changes only impact the individual in whom they occur. Understanding this distinction is especially important when we talk about genetic testing in multiple myeloma. It helps explain how this type of testing differs from something like a BRCA test, which looks for inherited mutations that increase the risk of certain cancers. In this video, our expert doctors will break down these differences even further and explain what they mean for your care and treatment decisions. How does the genetic testing done in myeloma differ from BRCA testing for breast cancer or consumer DNA tests like 23andMe?
BRCA is testing for the risk of familial breast cancer, and that looks more at what we call the germline mutation within the patient. So these are mutations that you have had, from birth, and those predispose the patient to getting, in this case, either breast cancer or ovarian cancer. So it is more looking at familial risk of getting breast cancer rather than just, what is the genetic makeup of the cancer itself. When we talk about genetic testing in myeloma, we're looking more at the genetic makeup of the myeloma cells themselves. It is not so much to do with the genetic makeup of the patient, but more what are the mutations within the cancer cell that are driving these mutations. So we call them somatic mutations, and these are different than germline mutations. And what I mean by that, if you were to take a healthy cell out of that patient, like a cheek swab or anything else, and you were to look at the genetic makeup of that cell versus the genetic makeup of the cancer cell, which is a myeloma cell, it'd be very different. So these are the mutations that have acquired along the way that have caused those cells to become cancerous.
Why is cytogenetic testing done?
They can provide different pieces of information for a myeloma patient. First and foremost is prognostication. There's certain genetic mutations out there, like deletion of 17p, translocation of 414, gain1q, that are associated with worse prognosis. So for those patients, therapy tends to be a little bit more aggressive. We need to be more closely following them, right? And also, it can provide data that can help guide therapy. So we do have, based on different trials, data that would suggest that certain types of therapy work better with certain mutational signals, for example, and that can lead to a better guiding therapy. Also, there have been throughout the years multiple attempts to find specific molecules that can target specific mutations. There is some data about what we call familial multiple myeloma, whereby there are certain kindreds that have a higher risk. However, the data is not as robust as it is for breast cancer. I definitely think this is an area where there needs to be more research and more data driven. Information that can help provide a sense of whether or not people in that specific sort of family kindred has a higher risk of multiple myeloma.
One of the biggest differences is the chromosome changes and the mutations that we see in the myeloma cells are typically something that that cell or patient has acquired over the years in that particular plasma cell. It's not something that they are born with or pass to their children. Whereas, for example, the BRCA gene that someone may have with breast cancer, they were born with that. Their offspring may inherit that. Whereas the plasma cell mutations that we typically see or chromosome changes are some things that happened over that patient's lifetime and are only in the malignant plasma cells, not in their normal healthy cells. Right now, we don't have any predictive genetic testing to say someone is going to develop myeloma or their children are going to. There's not really a specific mutation test.
23andMe and the other one that traces your ancestry, those are genetics of the body and the DNA that make up you as a person. That's not what we think of in terms of myeloma. Cancer is a genetic disease, and the genetics of that are abnormalities in mutation, chromosomal translocations from one region to another, mutations where genes are inactivated or overactivated, And then we're trying to get to grips with epigenetics. And so that's what we mean about it, is the cancer cells have gone wrong. And while it drives the whole cancer, we should see it as an opportunity, because the cancer cells have the mutations, which means there's something about the cancer cells that can be targeted by a therapy. And so if you can switch off the signals that keep the abnormal cells alive, because surely they should be dead, then they'll commit suicide. And a good example of that is when you target a gene called BCL2 with venetoclax. Turns out that the 11-14 subset of myeloma is exquisitely sensitive to that, commits suicide and dies. And so it's really important we study the genetics, because you can use it for many different things, including finding new treatments, predicting response to therapies, predicting the risk status for an individual person. So it's really important that we understand it all, because therein lies the secret to curing people.
To better understand the differences between somatic and germline mutations mentioned earlier in this lesson, watch the HealthTree University lesson on this topic in our Basic Genetics and Tumor Biology course. What is cytogenetics?
So cytogenetics is the study of chromosomes, which are long strands of DNA. And this DNA, it makes up the majority of the genetic information that cells have. So when we do studies of cytogenetics, the main interest is to try to understand if there are any changes in the chromosomes of these cells that have breaks or fusions that might help us understand what abnormalities are seen in these cells. So in order for us to live, we have like a recipe book in our cells, and that recipe book is DNA. And this DNA has all the sequences of how a cell should function and how our body should behave. And the chromosome is the one that stores these DNA information in strands, and it makes up 46 chromosomes in our body within each cell that has all of the DNA content of how we're gonna stay alive or survive.
How is cytogenetic testing done?
So cytogenetics can be done using different technologies. You could do karyotyping, you could do banding studies, you can do fluorescent in situ hybridization, or what we normally call FISH, and you might hear this word often when you see your doctor. These cytogenetic studies can be done on any type of cell that we want. When we're dealing with cancer and when we're dealing with multiple myeloma, we're specifically interested in learning about the cytogenetics of the cancer cells or the myeloma cells. By studying the cytogenetics of the myeloma cells, we can have a better understanding of what characteristics these cancer cells have. Are there any mutations that would make these cells more aggressive than other types of myeloma cells or other types of myeloma cancers? Or are there any changes or mutations, translocations, or alterations in the structure of this DNA content of the cancer cells that might make these cancer cells more aggressive or more resistant to chemotherapy? Or nowadays that we're actually starting to do targeted therapy, are there any mutations that these cancer cells have that we could potentially use as targets for the chemotherapy that we're going to use?
So cytogenetics just basically means testing the chromosomes of the cell. And so that can be done in a couple different ways. One way, a traditional way, would be looking at all the the chromosomes in a dividing cell and looking at the structure of the chromosomes. That's called a karyotype analysis. That often doesn't work very well in multiple myeloma because most of the cells won't divide in the test tube in outside of the body. And so we highly rely on a technique called FISH, or fluorescence in situ hybridization, for multiple myeloma, where we can use different colored probes to mark the chromosomes and decide if the patient has a deletion of a chromosome or a translocation with the FISH testing.
If you found this video helpful, consider giving us a like and subscribing to HealthTree University. Our mission is to educate patients and their care partners and spread awareness about multiple myeloma. We'd like to thank our doctors, our sponsors, and of course our audience for making this video possible. See you next time on HealthTree University.